The Ministry of Health has assured health professionals and the general public of a transparent and fair recruitment process as it continues the nationwide employment exercise for healthcare workers. At a press briefing in Accra, the Director of Human Resource for Health Development at the Ministry of Health, Frederick Mensah Champon, disclosed that the government has secured financial clearance to recruit about 8,000 health professionals this year. He also announced that additional recruitment opportunities, including a mop-up exercise and volunteer engagement program, will begin in the coming weeks. The ministry says the recruitment process is targeting critical areas with severe staffing gaps, especially in rural and deprived districts. In the Greater Accra region, Adan West, Adan East, and Ningo Prampram were among the districts prioritized for recruitment. The ministry also introduced a new recruitment portal to improve transparency and support district-level recruitment. On fraud-related concerns, the ministry warned applicants against paying money to individuals claiming to influence the recruitment process.
The Ministry of Health received financial clearance to recruit about 8,000 health professionals from the Ministry of Finance. The ministry acknowledges the anxiety and interest this recruitment exercise has generated, particularly given the backlog of about 105,000 unemployed health professionals, ranging from some having the last recruitment 2019, some 2018, and particularly for nurses was 2020 batches. These objectives, guided by the human resource policies and operational documents of the ministry and its agencies, such as Ghana Health Service, CHAG, Ahmadiyya Health Services, and Mental Health Authority, were used to determine the allocations by professions. In the interest of transparency, regional allocations were based on staffing norms and annual human resource requirements submitted by these agencies. Consequently, regions and districts with greater staffing gaps and healthcare needs and professions with a high impact on the sources of free primary healthcare policy received the highest allocations. I must say that all regions received some allocations, but not all metropolitan, municipal, and district assemblies were considered. For instance, if you take the Greater Accra region, it's only Adan West, Adan East, and Ningo Prampram municipality that were prioritized, though other districts also got some little of these numbers, but most of the numbers went to these three districts in the region. Nurse assistant preventive and registered public health nurses were prioritized in this category of nurses. Those two professions support about 40% of the 6,500 allocated to nurses. Allied health professionals, those that we have on the portal currently, they are about 30,226. And this spans from professionals who qualify to work with the Ministry of Health from 2019 to 2024. Nurses and midwives, we prioritize only 2021 batch, and their number is 16,860. Physician assistants, they also have from 2018 to 2024, and they are 4,631. Pharmacists, 2,975. And then pharmacy technicians, 1,778. With CRAs, we had about 5 of them also patched. 29,893 total accounts were created, with 2,636 without profile creation. So when we analyze the portal, we read about 29,893 accounts were created, but out of that, 2,636 were unable to create their profile. The rest of them all created their profiles. Include registered general nurses, 4,158. Registered midwives, 3,503. Nurse assistant clinical, 1,329. Nurse assistant preventive, 2,724. Registered public health nurses, 960. Nursing officer, 804. Medical lab sciences, 2,058. Medical lab technicians, 1,546. Physician assistant, 901. pharmacy technicians 720, and nutritionists 1,217. These are the top of them.